If you've traveled internationally, you know the drill. When you get back home, off the plane, answer a few questions about where you've been, and usually you're free to go. But if you traveled internationally between March and September, the drill for many was a bit different. In theory, if not always in reality, an officer from Customs and Border Protection would give you a health questionnaire. If you had a temperature or direct exposure to COVID, you'd get another evaluation by the CDC. It was an attempt to find sick passengers bringing the virus into the U.S. when it actually happened. But we found it put hundreds of federal employees and contractors at risk. Kayla Tausche reports in our CNBC investigation, Flying Blind.
It's irresponsible. It's murder. And it's just undignified.
Yvette Williams lost the love of her life, Omar Palmer, this spring to COVID-19. For 17 years, Palmer served as a customs officer at New York's JFK Airport. He was also a bodybuilder, a foodie, and in Williams's words, a protector. But by the end of March, with Palmer donning protective gear to screen passengers arriving from overseas, she wanted to protect him.
I said, Omar, I think this is a matter of life and death. And he said, I'll be good.
As the virus surged outside the U.S., the White House Coronavirus Task Force established the country's first line of defense at airports, assigning nearly 700 screeners from the Departments of Homeland Security and Health and Human Services to check international passengers for COVID symptoms arriving from a growing list of countries.
These prudent, targeted, and temporary actions will decrease the pressure on public health officials screening incoming travelers, expedite the processing of U.S. citizens and permanent residents returning from China.
The only problem, it didn't work. Joe Grogan led domestic policy for the White House until May.
Well, we weren't finding anybody. I mean, we were finding like 0 people. So it became pretty clear relatively quickly that it was, from a public health perspective, as far as identifying people who are COVID positive, it was a failure.
The Centers for Disease Control and Prevention says between January and September, 776,000 passengers were screened. Only 9 cases of COVID were detected. That's 1 out of every 85,000 screens. And as travel bans went into place, bottlenecks formed at Customs, at JFK's Terminal 4, where Palmer worked, in Dallas, in Chicago. The risks rising for workers on these front lines.
Basically, no travelers were detected to have COVID through this process. How many of the screeners themselves ended up getting sick?
More than people we identified is what was reported to the task force. I think it was in a few dozen is my recollection, but it was a pretty stark data point when it was relayed out that not only are we not finding anybody, we are getting more CDC and DHS employees infected with COVID at the airports than we are finding people.
6 task force officials tell CNBC the group discussed multiple times removing these screeners from their posts. Ultimately, they decided the role of these personnel as a deterrent and a show of force outweighed the costs. The officials requested anonymity because they still serve in or do business with the administration.
One official says the debate was not about the screeners themselves, telling CNBC, "We were aware that they were getting sick, but it was a question of whether the testing was effective." Another official says it was a running discussion for a couple of months. Ken Cuccinelli represented DHS in the early response.
There's always risk for people on the front line, but what we have found, including with our own frontline folks, is that those individuals, the ones who have caught the virus, have done so at rates similar to the communities in which they were working.
The CDC ended the screening program September 13th. 8 months after it began, 6 months after the task force first knew it was not effective. A November study released by the agency acknowledged the program was resource intensive with low yield of positive cases because they were only looking for people with symptoms. So how would you respond to allegations by other task force officials and some employees and some unions that this program was more dangerous for them than it was effective for the country as a whole?
Well, I find it hard to believe that, there weren't people just missed who had the virus that we were trying to screen for with the only tools that were then available.
For Omar Palmer, passenger operations would be his last assignment. He went home April 1st after being exposed at the airport and died 1 month later at 40 years old. Now Williams wonders what could have been done to save him.
To know that so much was known at the highest levels of government, and that that information was not shared, and that those that care was not given to frontline workers, people as collateral damage, and it's disgusting. They were disposable.
In a statement sent to us late today, HHS too defended the program, saying that early cases in the U.S. were indeed tied to travel and blaming China for obscuring information about how the virus spread. Task force officials tell me that at first they believed these screeners would make people feel safe to travel and discourage visibly sick people from getting on planes. But as we've learned, Shep, and as they learned early on, contagious COVID is invisible. Shep?
Kayla, you report that the task force discussed for months on end whether to end this program. When were they having those discussions, and what difference might that have made?
Well, different task force officials remember different time frames, but what all of them agree on is that the bulk of the data came in late March. That's when the discussion began. These screenings peaked around that time when the travel bans went into place, and they began trying to figure out whether these resources could be reallocated better elsewhere. The CDC, I'm told by these sources, was among the first to advocate putting some of these personnel not at airports, but perhaps at nursing homes or in other hotspots. And while we don't know exactly what the impact would have been on airports if some of these personnel were removed, we can say that there would have been a visible benefit to other communities had they been added.
Kayla, thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.